The violent protests in the city over the weekend could put those who attended and their families at risk of COVID-19.
Medical reporter Dina Baer has that.
On the Medical Watch, violent protests in the city may be putting people in danger in ways they don't realize. COVID-19 testing sites closed, limiting diagnoses of the deadly disease. And as protesters marched side by side, they risked spreading and contracting the virus that can now infect thousands of households.
God forbid that we see a spike that overwhelms our healthcare resources, just as we saw light at the end of the tunnel. But we need now to be careful and to take precautions.
Marchers, some not wearing masks, chanting, in some cases screaming, had the potential to fill the air with virus-laden aerosols.
When people are yelling or kind of speaking in a loud voice, you do have more projection of saliva and with that potentially virus.
The packed-in crowds did not provide the opportunity for the safe 6-foot distance.
You know, one of the reasons, obviously, we always make that 6-foot recommendation and have the cloth face covering recommendation is because those are the two best ways to prevent transmission.
Now, before mass infections spread, health experts are urging anyone who participated in the protest to self-isolate.
Please, in exercising your First Amendment rights, or if you were out for any other reason, you have now put yourself at risk. And we need you to isolate yourself. We need you to think about and be conscious of whether or not you are experiencing any signs or symptoms.
My worry is that, you know, we've already seen this so disproportionately impact Black and brown communities in Chicago, and it's one more piece here that we you know, what I want is for all of us, and especially those communities, to really get on the other side of COVID here. And so just if people can do these things that help keep them safe, help keep, you know, their close contacts safe, it's in the best interest of them and then really the whole city.
So if protesters have family members who are in high risk due to diabetes, heart disease, asthma, age, or obesity, stay far away from them.
And I really want people to recognize that over these next 14 days, first of all, I don't want you in close contact with people who have those underlying conditions or people who are over 60, because you have a higher potential than you did previously to spread it. Nothing has changed about COVID. And, you know, the problem is that the virus doesn't care what else is going on. The virus is just looking for opportunities to spread.
Testing was halted today, even for people with symptoms, as the Illinois Department of Public Health was concerned about staff and potential patient safety. However, the city of Chicago has plenty of testing sites through hospitals and clinics. If you have symptoms, the message is get tested. Back to you.